Hi, this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of the show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching. Hello everyone, and welcome to my new monthly live stream, Ask Dr. Orbeck, where I will address common questions that I get from patients at my practice at Regenerative Medical Institute, located here in Greenville, South Carolina. At Regenerative Medical Institute, also known as RMI, I specialize in areas of metabolic rejuvenation and rejuvenation medicine. I place an emphasis on sexual wellness and intimacy. So, if that is what the questions will relate to, I hope that these questions will answer what you're interested in, and if you're considering regenerative medical procedures, that you'll check it out all for yourself. You can always visit my website, rmi.live, for more information and to book a consultation. But for now, let's get started on this week's questions. So question number 1, what is PRP and how does PRP work? PRP stands for platelet-rich plasma. Platelet-rich plasma therapy is a form of regenerative medicine. Regenerative medicine strives to replace or replenish damaged tissue. PRP achieves these goals by using substances found in the human blood. And these substances give a healing process or a boost. These substances are growth factors. Your blood contains a liquid called plasma, along with cells and platelets. Platelets encourage your blood to clot after you get hurt. They also contain special growth factors that teach your body how to repair damaged tissue. Platelets can help heal injuries, help heal illnesses. They can also replenish tissue affected by the age regenerative process. PRP injections take place on site in my practice at Regenerative Medical Institute. First, we take a small amount of blood from your body. We then spin this blood, filter it properly in a medical centrifuge. Spinning the sample creates a concentration of platelet solution. It actually forms above the serum as a buffy coat. Second, we spin the blood through a medical centrifuge, and then we create a concentrated solution that we inject into the targeted tissue. Once it's inside your body, the solution releases growth factors, as well as stimulates the immune system to help come in and do tissue repair. These compounds help regenerate damaged tissue. So PRP can help with incontinence, low libido, and other intimate concerns. At our practice, we're proud to offer the P shot and the O shot, which are simple, discrete procedures that can help you restore your confidence, boost your stamina, all of which I will cover in my next questions. Okay, so the second question is, after we just talked about the O shot and the P shot, it's legitimate to ask, what is a P shot and who may it be helpful for? P shot is basically a form of PRP, which stands for the Priapus Shot. Priapus in Latin stands for penis. The P shot is one of the ways we treat erectile dysfunction here at RMI. It involves taking a patient's own blood platelets and injecting them into the penis after activating growth factors. That rejuvenates the penis, allowing more blood flow into the organ, enhancing its sensitivity, and deliver enduring improvement in sexual function. According to the manufacturer's recommendation on the website, it may also make other therapies such as Viagra, Cialis, work better. I find that in combining these therapies, I have an optimal outcome. The Priapus Shot was designed to improve sexual performance in men, especially those who have lost function due to an enlarged prostate or prostate cancer. I recently had a patient in my practice like that had a prostatectomy, had a very difficult time with erectile dysfunction. And with the use of a P shot and other forms of therapy, he was able to regain his function. P shots are often used after the effects of surgery, during drug side effects, and other conditions such as diabetes. Some of the benefits of the P shot include the following: increased firmness of the erection, improved sexual stamina, increased sensation and pleasure, increasing blood flow and circulation. It may also increase the penile length and girth. A post-procedural survey showed that 70% of men, given the Priapus shot, had an increase in the length and in the circumference of the penile shaft. The P shot may be right for you if you are dissatisfied with your sex life or your intimacy at this time, or your sexual life may not be as optimal as you hope. More than 18 million men struggle with erectile dysfunction, so you're not alone on this. Millions more have trouble with low libido or loss of stamina. These symptoms can have a significant impact on the quality of your life, and many patients report feeling even depressed or down or flat due to these issues. The P-shot can help restore vitality, and many patients enjoy the full results of their injections within only 3 to 4 weeks. Typically, the P-shot works over a full 6-week period, and I combine it also with some penile pumping to help its effectiveness. The next question we're going to talk to, and we discussed earlier, is what is the O-shot and who may it help? The O-shot, as opposed to the P-shot, is a form of PRP designed for women, and it stands for the Orgasm Shot. In the same way PRP can regenerate the skin of the face, it appears PRP regenerates health in the vaginal tissue as well. I have certainly seen this in my practice. I have several individuals with a very terrible, discomforting disease called lichen sclerosis, and using the P-shot has completely eradicated the symptoms, allowing them to have a normal sexual life. And that is very difficult with this type of disease. So, using this same technology, the O-shot procedure works by using PRP to stimulate stem cells and to grow healthier vaginal tissue. The O-shot procedure begins with a blood draw. Then the growth factors in platelet-rich plasma are extracted from the blood sample and injected into the area near the clitoris and an area in the upper vagina that is most important for the sexual response. This is called the O-spot. The process takes less than 10 minutes in the doctor's office and causes little to no discomfort due to numbing that I use with a local anesthetic. Some of the benefits of the O-shot are as follows. You may have greater arousal from clitoral stimulation. You may have younger, smoother skin of the vulva, which are the lips of the vagina. You may have a tighter vaginal opening, a stronger and more frequent orgasm, and a combined clitoral and vaginal orgasm. There's often seen an increased sexual desire or libido, decreased pain for those with painful intercourse, increased natural lubrication, which is common in many women as they approach 45 to 50. And also what I really find helpful is a reduction in urinary incontinence. I use this shot a lot for issues with urinary incontinence in women. When I see women that go to the gym and they're afraid to do sit-ups or they're afraid to do some lower leg work, or they may have to wear a pad because they're afraid of leakage, this is the type of person I love to help. After typically one O-shot, and then I give them a device that helps with the stimulation of the Kegel muscles within the pelvis, that combination almost eradicates incontinence entirely in 85 to 90% of my patient population. The O-shot may be right for you if you are dissatisfied with your sex life, or you find sex to be painful, uncomfortable, or you have issues of mild urinary leakage. It doesn't have to remain that way. Low sexual desire is an incredibly common problem that affects many women, regardless of age. So again, you are not alone. The Journal of the American Medical Association recently found that nearly 43% of women experience sexual dysfunction. And low sexual desire is present in approximately 26% of premenopausal women and up to 52% of menopausal women. So this is very common. So if you have any questions related to regenerative medicine, PRP, male or female sexual wellness, or more, please leave your questions and comments, or you can submit questions via email to our producer, Katie at dnagency.com. And that's all for today, and I'll be back next month with other round questions. If you can visit my website, rmi.live, for more information on these things we talked about today and to possibly book a consultation, that would be great. I will give you the time, review your symptoms, the underlying problems, and outline a treatment protocol for you. Your initial contact will be Ava. She's my wife in this office, and you'll find it very pleasant to talk to her. Wish you a great day, and I look forward to talking to you soon. Take care. Hi, this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of this show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching.